right, so now let's take a look at left-sided heart failure. Again, patient's right, patient's left. Well, you've got the left atrium that pumps down to the left ventricle. And if these aren't working very well due to heart disease, advanced age, previous heart attacks, that means that the pumping ability of the left atrium and the left ventricle are impaired. That means that blood entering that left side of the heart is going to back up. Much like with right-sided heart failure, it's a traffic jam. So if you have a car wreck at an intersection and cars can't get through the intersection, they're going to back up, back up, back up, back up, further away you get from the intersection. Same deal with the left side of the heart. Well, blood enters the left side of the heart, specifically in the left atrium, from the pulmonary circulation, from the pulmonary veins, from the right lung and from the left lung. You're bringing oxygenated blood, returning it back to the left atrium, which should be pumping to the left ventricle, which should be pumping out to the rest of the body through the aorta. However, if you're in left-sided heart failure, the blood entering the left atrium will back up. Back up, back up, back up, back up, back up, back up, back up. So now we have increased pulmonary pressure. So we have a traffic jam, traffic jam, traffic jam, traffic jam, traffic jam, traffic jam. The pressure can get so big, so high, that fluid will then leak out of the vasculature, out of the capillaries here, and it will squeeze out in between these junctions here between the simple squamous cells. Remember, simple is one layer of cells, squamous is flattened cells. So now we're going to get fluid that leaks out, and that fluid sits around the capillaries. The main problem is that fluid will then come in between the alveolar capillaries and the pulmonary capillaries. Now, remember, when you breathe in oxygen, you're going to have a high concentration of oxygen within the alveolar space, low concentration in the pulmonary capillaries. So the oxygen is going to diffuse from high to low concentration down its concentration gradient. However, if we have fluid that is sitting in between these cells, it's going to make it much more difficult for this oxygen to diffuse into the pulmonary circulation and be taken back to the heart. In addition, we have a high concentration of carbon dioxide in the pulmonary vasculature, because remember, that just got pumped to the lungs via the right ventricle. So we've got a high concentration of CO2 that we need to get rid of, because if we don't get rid of CO2, it combines with water to form carbonic acid, dissociates to form bicarbonate and hydrogen ions, and we know hydrogen ions and meat tenderizer, how that all works. Your pH is going to drop and you're going to tenderize yourself from the inside, so that's bad. So we need to get rid of this CO2, but the problem is it can't diffuse easily into the alveolar space because of this fluid that's in between. It's called interstitial fluid. So the patient now has impaired gas exchange at the pulmonary level here. So they are going to have fluid, basically fluid sitting in the lungs, plus some of that fluid can actually enter the alveolar space here. So these patients are going to manifest themselves by having dyspnea. They're going to be short of breath. And these patients are not going to want to lie down flat. These are the ones that are going to be seated bolt upright, and if they try to lie flat, they're going to panic and they're going to get very anxious and they're going to do everything they can to sit up. So these patients need to be seated, need to be not laying flat, not supine, and they're going to be short of breath. So we need to give these folks oxygen, and we need to pull some of this fluid away from their lungs. So there are a couple things that we can do. One of the things that works, not emergently though, but what works over the long term is diuretics. Okay, so now hopefully you've got a pretty good idea about right-sided heart failure and left-sided heart failure. So again, right-sided heart failure manifests itself by pedal edema, whereas left-sided heart failure manifests itself by dyspnea, chest pain, orthopnea. Orthopnea is the inability to lay flat, to breathe effectively while laying flat. So you can either have a patient in right-sided failure or left-sided failure, or both. And one of the things that causes both right and left side heart failure are previous heart attacks. So if you have a patient with pedal edema, swollen ankles, swollen feet, one of your questions should be, how's your heart? Have you ever had a history of heart failure, congestive heart failure, or heart attack? Okay?